Then I was so fixated on one aspect that I wasn't looking at it in the right way. This is going back 22 years, this case. So we've got to be very critical, and we've got to keep up with the times. As you've seen many times now, the difference between females and males has to be explored. We're fundamentally different. Females, in a short summation, females, as you age, you become more masculine. Okay? If you actually analyze carefully what happens with the aging process, you'll realize you actually start to revert to a more masculine type face. And males just get older, which is why actually males can get away without very little intervention for much longer. Females don't like it if we over-treat, and in fact, you've seen the mistakes that can happen. So this guy is an interesting one. He wanted me to widen his jawline. You've seen what we do. So I've pronounced and exacerbated his gonial angle. And then he went somewhere else to get his Botox done. So have a look at his forehead. Feminized. Too smooth. Tail of the brow is raised. So he's kind of like half-half.
No.
Women want to be feminized. So we want to taper and give them a heart-shaped, feline, beautiful feminized form to accentuate their cheekbones. Males, when we do their noses, non-surgical, this is a case where I think I've over-feminized him. I've over-feminized him. I prefer this case where I've left him not so perfect. So what I do now, 2019, I make my males less perfect. I deliberately factor that in. Less is more with males. If you over-treat them and try and get too linear, they'll look too feminized. So hold back with your males. Hold back with your males. At the floor of this, the foundation of this, as I've said many times, is a three-dimensional process. You've got to think about all the tissues. Because what you're seeing in the final picture is a combination of all of those tissue types. Bone, fat, ligaments, muscle, skin are undergoing the aging process. And I think bone fundamentally sort of is the catalyst. It is the one feature, one tissue type that really determines what goes on. Let's have a look at this lady, 22 years of age, 75, so 53 years later. Beautiful woman, absolutely beautiful woman, very symmetrical features, and this is taken in 1950. Look what happens. It's horribly depressing. And have a look, and you can see here, you can see when she talks. So it's not just, when you assess a person, you don't just assess them with a static photograph. You've got to look at dynamics. So start taking videos, guys. Every single one of you should be assessing your patients three-dimensionally and also in dynamics. You'll see the reason why she's in this state is because she's lost skeletal support. Now, my background is oral surgery. But it doesn't matter what your background is, because the end result has to stack up. Okay? So I come at it from a bone and teeth and skeletal fashion. So I'm going to restore function. So in this case, these teeth have to be removed. I'm going to do implants, bone reconstruction. So I use bone from a Calvarian, grafting to restore volume to the maxilla and the mandible, to give them implants so that when I restore her, she's now at a state. These are fixed teeth. These are individual teeth. Fixed. Look at the gum work. Look at the support for the lips. The marionette creases. The labial mental crease. Even the anterior nasal spine will benefit because what you've done is supported the perioral matrix. So we have to think three dimensions, guys, when we're doing aesthetics. You can't think with just a little syringe and think that you can inject your way out of trouble, because you can't. Sometimes less is more. It's about knowing where to look. I took the lips off Angelina Jolie and Julia Roberts just to demonstrate this. That's all I've done. Have a look carefully. It's an absolute game changer. Just by that one maneuver, I've changed the personality of that patient. I've made her look more miserable, less, in fact, some would argue, older, a little uptight, perhaps. All from one maneuver. So when you're talking to your patients, make sure they realize the benefits of a full face approach. Understanding what we're going to do, various designs that we can do. Sometimes less is more. All I'm going to do in this lady is open up her eyes. Look what I've done to her face. by carefully, strategically positioning my toxin to allow a better orbital aperture. That's it. It's completely changed her face. Symmetries, so important, particularly with ladies. So if we bring about symmetry into our cases, we'll go closer to aesthetics. But we don't always want to be completely and utterly symmetrical. We have to be careful. This is a classic case of a lady who wants a bit of everything but doesn't want too much done. She didn't want her lips done, she just wanted to look less tired, smooth out some of those wrinkles, and anyone who does enough treatment knows that this is a tough case. Because your back's up against the wall, you can create ptosis very quickly. So to flare those brows and eradicate those lines and bring about volume in the mid-face, you really need to know what you're doing. And it's a game changer. And then this lady can go on and have other treatments. 32-year-old starts to look old and more masculine. Why? Because the flatness of her cheeks. Fred talked about the central aspect of the cheek. I completely agree with him. I factor this in every single one of my cases. Many of you have been on my courses. I call this KC0. It's a sweet spot for a woman. I call it the estrogenic point. If you bring this out, see what happens. Not only will you develop the OG curve, look what happens when the light bounces off. If you look carefully, I've restructured the proportions of her lips too, but very subtly. Look carefully. Think like an artist. Look at the upper lip before treatment, look at the balance, and then see what's happened. 31-year-old. So it's not just the oldies that suffer. As we get older and older, and some people genetically, because of the absence of bone, will start to age unfavorably. Fact. And you can see when she talks, look at the dynamics of those beautiful, flowing, feminized cheekbones. That is what we need to do. Restoring volume in the right place, not to the point where they look alien or like avatars. Very, very important. Now, many of you have done my profile, and in fact, I'm going to be doing a whole section today, later on, and tomorrow. And I've created parameters. You saw my friend talking about his parameters, and I think like an artist, so I develop parameters to help me, guide me. But I do not have a protractor, and I do not have a ruler in sight. Look at Fred here. Not a protractor, not a ruler in sight, but work of art. Because he's thinking like an artist. If you're 2 millimeter perfect, you're missing the game. Now this is a lady I treated, you saw last year in Monaco. 23-year-old girl. What do you think she's going to complain of? Submental ptosis, double chin, flatness of her lips, slightly retrognathic chin. She feels her nose is projected because the nasofrontal sulcus is large. So what we've done is we've restored volume, and this was done in 15 minutes before your very eyes. Because if you know where to look, it ain't going to take long. You've seen Fred doing a beautiful work very quickly, restructured. And again and again and again, you can restore balance. Look carefully, it's a full face approach. Full face approach. And we know what happens to the bone as we age, and we've got to take into account racial differences. Guides are good, but I don't use them. If you understand how to assess the face correctly, you know all of the areas that need to be restored non-surgically. What I like about this case is the profile. Look at the profile, look at the submental ptosis, 45-year-old girl. You can see she's going to complain about that. Now when I do her treatment, look what's happened. I restored balance to her jawline, her chin, her lips, her nose. Even her nose has been treated very subtly. Sometimes it's the subtleties that count. And my final case is a case you've seen, but you've not seen the work up to this. This lady actually came initially, back in 2015, to have a nose done. I told her at the time, and you should all do this, do a proper face assessment. I said, listen, for me to do this properly, I need to do the full face. She said, listen, just fix my nose. She loved the result, but she came back And this is her straight after her nose. She loved the result. She's going crazy for it. 2 weeks later, you know what's going to happen. She says, I want the rest of my face done. And I'm going to do her volume in her cheeks in the right place, centrally and laterally. Lips to restore balance and harmony. Chin actually needs to be shortened. She has a very pronathing and lengthened menton and nathion. So what we need to do is bring about the illusion of a chin lift. And if we do this correctly, you'll see the profile has been completely changed. But what you don't see is the facial view. So if we look at the lady now, this is her after treatment, sending me a video. Remember, she wants to be glamorized, so this is a little bit more glamorous than some of our patients would like, but it illustrates the point very nicely. So it's completely feminized a lady who otherwise had a very flat face, and you can see a very prominent nose. So, in passing, remember what I say to you guys, if you only have one track mind and you only look at things in one direction, you're going to miss the big picture, because actually, sometimes your assessment then is flawed. Thank you very much, ladies and gentlemen.